Welcome to this explainer. Today, we are opening up a fascinating and, frankly, a pretty terrifying medical case file. You know, the human body is like a heavily fortified castle, right? But the invaders we're looking at today, tissue nematodes, are absolutely the ultimate stealth specialists. They're these microscopic rogues that completely bypass our normal digestive defenses to set up camp deep inside our muscles, our eyes, our skin, and yes, even our brains. Okay, let's get this concept down right away, because eosinophilia is the unifying biological response you're going to see for almost all of these parasites. When these tissue nematodes invade, the body doesn't just send out its regular, everyday foot soldiers. It sends out eosinophils. Think of eosinophilia as a massive, highly specialized SWAT team of white blood cells acting as the body's flashing red alarm system. Whenever you see the specific alarm sounding in a clinical scenario, a tissue nematode is immediately your prime suspect. All right, here's our most wanted list for today. We've got number 1, the muscle invader. Number 2, the playground threat. Number 3, the creeping eruption. Number 4, the brain invaders. Number 5, the sushi surprise. And finally, number 6, we'll wrap up with some vital parasite survival tips. Let's kick things off with our first suspect. Section 1, the muscle invader. Trichinella spiralis. So this is actually the most common tissue nematode worldwide. It's a total master of disguise, typically hiding out in undercooked pork, but also in the meat of carnivores and omnivores. We're talking bears, horses, and even walruses. Its terrifying journey through your body happens in 3 distinct phases. In week 1, the enteric phase, it just causes basic stomach upset as the adults settle into the gut. But week 2, that's when the newborn larvae start migrating through your bloodstream. This causes fever, swelling around the eyes, and those little splinter hemorrhages in the nail beds. But here is the massive, high-yield clinical trap you absolutely need to remember. During this migration, the larvae can invade the heart. Heart failure from myocarditis in week 2 is literally the most common cause of death from this parasite. If a patient somehow survives that, weeks 2 and 3 bring muscle encystment. This is where the larvae actually coil up and build a wall around themselves inside the skeletal muscles. It causes severe pain and, you guessed it, triggers that massive eosinophilia alarm. Now keep this specific temperature in mind, -15 degrees Celsius. Freezing standard pork at this temperature for 3 weeks effectively kills normal Trichinella spiralis. Sounds easy enough, right? But if you're hunting up north, you've got to beware. There's an invincible Arctic strain, Trichinella nativa, found in walrus and bear meat, and it is completely resistant to freezing. You absolutely have to cook that meat thoroughly, or it's still going to be highly infective. No exceptions. Moving on to our next suspect. Section 2, the playground threat, Toxocara canis and KT. This particular parasite lurks right in our own backyards, in warm sand and soil contaminated by dog or cat feces. And tragically, it primarily targets unsuspecting, playful kids. The really crucial point to grasp here is the sharp, dangerous contrast in how it attacks, which totally depends on the patient's age. The visceral form usually strikes preschool kids who might be eating dirt. It triggers massive eosinophilia and an enlarged liver and spleen. But contrast that with the ocular form, which tends to hit older children and young adults. It causes a unilateral lesion in the back of the eye, but critically, and I mean critically, it triggers absolutely no eosinophilia. This is a massive clinical trap. Recognizing the ocular form of Toxocara can literally prevent unnecessary eye removal surgeries. Why? Because the lesion perfectly mimics a deadly eye cancer called retinoblastoma, but it completely lacks that classic eosinophilia alarm system we normally rely on. And that brings us right into a major diagnostic pitfall. You'd probably think a stool sample is the obvious first step for any intestinal parasite, right? It just makes sense. So why is it completely useless for diagnosing Toxocara? Let's break down why that's such a massive trap. The answer is simple but wild, because the larvae never actually develop into adult worms inside humans. We're what you'd call dead-end hosts. The eggs have to incubate in the dirt first to become infective. Once a human swallows them, the larvae hatch, but then they're just confused. They don't know what to do. They don't mature in the gut to lay eggs that would ever show up in a stool sample. Instead, they just hopelessly wander through the deep tissues, the liver, the lungs, the eyes, just causing inflammation wherever they happen to go. All right, let's head to the beach. Section 3, the creeping eruption, cutaneous larva migrants. You can pick this one up simply by enjoying a vacation and walking barefoot on a contaminated beach. This is the dog and cat hookworm.
The larvae hatch in warm, humid soil or sand, and they literally just wait. All it takes is direct skin contact. A bare foot or maybe a child lying on the sand. They burrow in, but human skin is actually too thick for them to penetrate deeply, so they get trapped right under the surface. They migrate a few centimeters every day, creating these really distinct, winding, intensely itchy tracks along the skin. Diagnosis is purely clinical, based straight up on those visual tracks. And the good news here? Even without treatment, humans are once again a dead-end host. The larvae eventually just die off on their own in a few weeks to months. But if the itching is driving you crazy, it's easily treated with antiparasitic drugs like ivermectin or albendazole.
Time for things to get a bit darker. Section 4. The brain invaders. Angiostrongylus cantonensis. Highly prevalent in Southeast Asia, the Pacific Basin, and the Caribbean, the life cycle of this rat lungworm is just wild. Step 1. Rats pass the larvae in their feces. Step 2. Snails and slugs eat the feces and get infected. Step 3 is where we stumble into the picture. It's a little gross, but accidentally eating a raw infected snail, or honestly simply consuming invisible snail slime left behind on your unwashed leafy greens, is all it takes. Once ingested, step 4 kicks off. These larvae bypass the gut and make an absolute beeline directly for your central nervous system, right into the brain, where they eventually die and trigger a severe inflammatory response. Because of that incredibly specific life cycle, this rat lungworm is actually the #1 most common cause of eosinophilic meningitis worldwide. Patients will show up with severe frontal or occipital headaches, and a spinal tap is going to reveal a massive wave of white blood cells, specifically our SWAT team, the eosinophils, in the brain fluid. But here's the kicker. The larvae themselves are rarely ever actually found in that spinal fluid. The diagnosis heavily relies on clinical symptoms and taking a really good history to find out if they've eaten raw vegetables or snails in an endemic area. If there is one absolutely crucial medical warning you take away from this invader, make it this. If you treat angiostrongylus with an antiparasitic drug like albendazole, it may only be given with steroids, never ever without. If you just go in and kill off the worms in the brain using antiparasitics, but you don't use steroids to calm down the body's immune reaction, the sudden die-off of all those larvae will exacerbate the brain inflammation to incredibly dangerous and potentially fatal levels. Section 5. The sushi surprise, gnathostomiasis. Operating through raw or undercooked fish and poultry, think sashimi in Japan or some pho in Thailand, this parasite uses a highly complex food chain delivery system. It starts with tiny water fleas acting as the first host. Then, fish, frogs, or chickens eat the fleas. Finally, humans come along and consume the raw infected animal. The end result? A single larva gets loose inside the human body. And because it's totally lost inside the wrong host, it migrates erratically through your tissues. It just wanders around, popping up and disappearing, sometimes over the course of several years. Most commonly, this wandering causes painful migratory swellings just under the skin that vanish and then come back later. While those skin swellings are intensely annoying, there's a really dark side to gnathostoma. If this larva happens to migrate up your nerve tracts and into your central nervous system, it causes shooting, radicular pain, paralysis, and if it reaches the brain itself, it causes devastating, often fatal, hemorrhagic tissue destruction. At that point, a spinal tap isn't just going to show eosinophils. It's going to yield bloody or yellow spinal fluid due to the internal bleeding the worm causes as it literally chews through the tissue. All right, let's bring it all together. Section 6, Vital Parasite Survival Tips, Mastering the Clinical Traps. Let's rapidly consolidate everything we've unpacked today into a master set of actionable survival tips. For Trichinella, remember it's hiding out in pork and bear meat, and myocarditis is the lethal week 2 trap. Toxocara is lurking in dog feces at the playground, and its ocular form is a massive trap because it perfectly mimics cancer without triggering the eosinophilia alarm. Cutaneous larva migrans is all about that beach sand and those winding itchy skin tracks. Angiostrongylus is the snail slime invader causing eosinophilic meningitis, and remember, never treat it without steroids. And finally, gnathostoma is your sushi surprise, causing swellings that recur for years and devastating bleeding if it makes it to the brain. Before we wrap this up entirely, there's an incredibly specific diagnostic quirk for the muscle invader, Trichinella, that you have to know. If you suspect it and decide to do a muscle biopsy, but you just slice the muscle thinly and prep it normally for a microscope, you will completely miss the worms. You have to literally take the fresh muscle tissue and smash it, physically compress it between 2 glass slides to find the coiled culprit hiding inside. We have covered a lot of ground today, tracing the steps of these microscopic criminals, knowing how these stealthy invaders operate, how they use something as simple as snail slime, warm beach sand, undercooked bear meat, or raw fish to entirely bypass our body's defenses. How will you change the way you cook your food, wash your vegetables, and interact with the outdoors? Keep that in mind the very next time you're tossing a salad or taking a barefoot stroll on a tropical beach. Stay curious, stay observant, and keep learning. Catch you next time.